So fillers must be more expensive than Botox?
Yeah. In India, the chin is a big problem in India because most of the Indians we lack chin. Looking tired. What happened to you? It's just a fraction of a second. Everybody says that. And reduced her face. We made her slim and made her look pretty and lifted eyebrows.
You can make somebody look slim.
Yes.
You're saying that injecting hyaluronic acid will be more effective than applying it on the skin.
Exactly.
The fillers, Botox. How much is the cost difference?
An ideal injector who makes the changes noticeable, as in the looks wise, but where exactly has changed, we don't know. They have to keep searching. Where is the change?
Botox, fillers, thread lifts, and facelifts. Are these just for a frozen face or is it actually the fountain of youth? Today's episode, we are getting skin deep with Dr. Sanjay Nellogi, India's most celebrated aesthetic physician. You guys are extremely lucky, and so am I to have him on my podcast because he not just does these procedures day in and out, he has also trained thousands of doctors for these procedures. So, welcome, sir, and thank you so much for taking out time for my podcast.
Thank you so much, Aditi. I'm so honored to be on your podcast today to talk about the Botox and fillers.
So, sir, you do these procedures day in and day out, Botox, fillers, etc., etc. Which is the most sought after procedure which people want to commonly get done in your practice?
See, to be precise, in my practice, I do mostly the Botox and fillers, and sometimes the thread lips also. So because I'm known for Botox and fillers,
Yeah, you're the Botox guy.
kind of because I've trained many doctors, and I still train. So yes, I get a lot of Botox and fillers queries.
And what about the age group? Like, which age group is most commonly getting this done? And what's the youngest age group that you have actually done the procedure?
I can tell you one story because long back I did one girl who was just around 19 or 20. She was going for that time there was Jet Airways, you know that? So she was going for an interview. So she just wanted to do a little enhancement. And if you have read the article in US, they say, first impression is always last impression. And especially before going to any interview, they do a little enhancement if needed. It's not that everybody needs it. If needed, they do it, especially the frown. You don't want to sit with the frown in front of your interviewer, because he may say, oh, this boy or girl, it doesn't suit this job profile. So at least they used to do the frown line Botox so that it reduces the lines, looks stress free or less angry, and then that's how the articles spoke about. So she wanted a little brow lift, and she had a little broad face. So we raised her eyebrows and reduced her face. We made her slim and made her look pretty and lifted eyebrows.
You can make somebody look slim.
Yes, if it is due to the muscle, that is a masseter muscle. So she was 19, and I have a patient who is 85 plus. She keeps coming, and we keep doing it, whatever she needs it. So there's no age limit. Yes, for the approvals, FDA, it is around 18 onwards for the cosmetic purposes. But the Botox, therapeutic purpose also can be done. So we start as early as in a few months also.
Interesting.
Yeah. Botox is used for therapeutic purposes also. So the kids born with thyloria and
Thyloria.
sialoria,
Siloria, okay.
the salivation. So they do that in the parotid gland to reduce this thing. So there is no therapeutic. There is not much of constraints with the age, but in cosmetic, 18 onwards legally. Yeah, so we get 20 plus mostly. The most of the common age people we get is 30 plus.
And all these procedures, Botox, thread lifts, fillers, do they just have cosmetic benefit as in just for looking good, or will it actually help the health of the skin also?
They do. Because it's not only Botox and fillers, but a lot of combinations we do to improve the skin qualities. Nowadays, it's not just the improving the contours or giving you something which you don't have it, but we talk about the skin quality with skin boosters.
Okay.
They improve your skin quality.
They're like injectables?
Injectables, yeah. But with skin boosters, we injectables, but there are lasers also, peels also we do to improve the skin quality. But with injectables, yes, we have skin boosters as well to improve the skin quality.
Okay, what kind of skin boosters? Can you just name some?
There are certain names in the market. There's Skinwave, Vital, and
What which is
hydroxysterase. This
actually?
HA, all are HA, hyaluronic acid gels.
Oh, okay.
It all depends. The companies, the different companies have made them little thicker, thinner, medium, cohesive
So you're
materials.
saying that injecting hyaluronic acid will be more effective than applying it on the
Yeah,
skin?
exactly. Because you need it inside, not outside. Yes, outside also you need it just for the surface. But if see, as we age, we lose collagen, we lose elastin, we lose HA also. So we need that. And as we age, the skin gets drier.
So then at what age should we start this? If somebody really cares about their own health, skin health, and they are willing to do this, then
See, nowadays what we see is, the people, you don't have to be old enough to look old
okay.
because of the lifestyles, because of the stress. So people look much older or, matured much early with all this pollution,
Correct.
lifestyle. People sit in front of the laptop, sit always in the AC, thinking, AC se kuch nahi hota. AC makes your skin very dry.
Oh,
Yeah. So you need a lot of air, you need a lot of humidity. So you need to improve the skin quality also. It's not just contouring or, filling the hollows or something, but you need the skin quality also equally important. But nowadays, if you ask me, the trend in injectables is skin quality. Many
okay.
people are going for skin quality.
Okay, so even in my 30s, I can start these HA boosters and maintain my skin health.
Exactly. Yeah, maintain. Yes, that's a good word. Maintain your skin quality.
Okay.
And at aging, with weight loss, if we have lost those youthful features, we can, build them with the regular derma fillers.
Okay. So these procedures, Botox and fillers, are they safe enough?
Yeah.
Because people are always scared in India about injections.
They were, not anymore, too much. But yes, if you compare the global market, India is much behind. But if I compare, because I've been doing this is my 18th year of injections. So since 17, 18 years, how it used to be and how it is now, it's a huge difference. But if you compare with global market, we are much behind. Comparatively with the amount of population we have.
So where the maximum procedures being done in the
US,
US?
Singapore, Korea, they're small countries, a small population. They do much, 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 much more injectables. Korea is one of the biggest markets for all the aesthetic
No wonder they have amazing skin. So
Korean skin type, Korean
Yeah.
glass skin. There are so many things keep going.
so that's the secret behind their beauty.
They are very conscious, and they have a lot of the budget issue also. In India, people, a budget is not like in India. I've spoken with many my friends from abroad. They say it's
Yeah.
not only India, it's everywhere. It is
Everywhere.
there, but they're conscious.
Yes.
But that thing is coming. It's catching up in India also, because people are working themselves. They take their own decisions. Before, पहले क्या होता था, husband को पूछना है, dad को पूछना है, all these things. But now, I want to do it. I want to do it. That's
Financial independence definitely helps.
exactly.
Yeah. So we'll come to the cost part later again, but I want to know that these procedures, office-based procedures, which you do in clinic, it's just a one-day thing. Are these more effective than getting a surgical facelift done, or like what are the pros and cons?
See, there are two types of patients who really need surgery. See, it depends on their expectations. With a lot of volume loss, too much of sagging, and they want everything to be done. With injectables, we have a little limitation. So in that case, we only suggest, if you want all that, then you go for surgery. Meet a surgeon, then they will decide what to do, what not to do. But if it is a mild to moderate and they're affordable, they can do whatever it is. So we do non-surgical facelifts with Botox and fillers, or maybe thread lift, maybe the lasers also, because we do all combinations.
Everything to get the maximum effect.
Exactly. It's not just
Okay.
one, it's a combination always works. But yes, with surgery, many patients are afraid of cuts. The moment you say cut, they're okay with pricks, not cuts. Even if the surgeon says a small cut will do for skin implant, they do inside, the cut is inside, they say no. And fillers are like, they're called as lunchtime procedure. They get it done during the lunch, go back to office. Yeah.
Oh, Oh,
It's
it's very easy procedure.
easy. It's very
But then, how long will the effect last? Like, how often will I have to get it done?
Botox, of course, it lasts around 4 to 6 months. You can say twice a year.
Twice a year.
Fillers, 9 to 12 months, depending on how much you used it, where you have used
Longer
it.
lasting.
Yeah, 9 to 12 months. But some products last more than 1 year.
Oh.
But that depends on how much you use, the optimal dosage. But because of the budget, we usually tend to do a suboptimal dose. So you can take around 9 to 12 months. Once a year, maybe a little touch up here and there, little, that should be good enough. Twice a year Botox, once a year filler should be good enough. But skin boosters, around twice a year. They last around 6 to 7 months.
Okay. I actually forgot to ask you that when you actually do a Botox and when would you recommend filler?
See, Botox is for wrinkles, the forehead lines, the frown lines, crow's feet, sad face, bunny lines, all these things.
Bunny lines. What are bunny lines? Okay.
Crunch lines,
Uh-huh.
disgusting kind of thing. We make faces. That means we are using the internal muscles. The muscles are attached to the skin. When the muscle is contracted, since it is attached to the skin gets crumpled also. That's why you see the lines.
Okay.
So you need a relaxant.
Okay.
So Botox is known to relax the muscles. So we inject the muscles into that respective muscle so that muscle gets relaxed.
Even the under eye sagging?
That's filler.
Okay.
That's the volume loss, which causes a hollow and sagging. Then the filler comes into picture.
Okay.
I spoke about the face looking broader, the jawline getting a little saggier, the neck muscle, the platysma also gets very strong. So we relax that muscle so that the jawline it's called as Nefertiti lift. So we do that so that they get a chisel jawline. The neck becomes more tighter. And when you do the Botox or the masseter muscles, if it is caused by the muscle, not the fat, then it looks much slimmer and you get those compliments. You lost weight. That's it.
So fillers actually fill up voids.
Fillers, yeah, as I told you, as we age, we lose collagen, we lose fat, we lose elastin, HA, all of that. Yeah, fat goes off. Okay, so and there are a lot of ligaments and many anatomical features which get affected with the aging. So since we need to rebuild that area, so what is the best solution is the HA which we have in my hand.
In the filler also, you all put HA only?
HA, it's a HA only.
Oh,
all are HA only.
So
all
then what are the
natural
difference
products.
between fillers and skin boosters?
It's how thick and thin is that filler.
Okay.
Or the HA filler.
Okay, you mean the dose?
Not those. The companies make it in such a way that for certain areas they make a thick filler.
Okay.
Certain areas medium thick filler. Certain areas like under eye,
Huh.
lips, very soft and thin fillers.
Okay.
Skin boosters are much thinner. They're like water, but they're like water, but they're not water.
Not water.
They're all cross-linked. So they are HA cross-linked, so they can cause problems if not done properly. So that's why the anatomy, knowledge, injection techniques, when to do, what not to do, the injector has to know about all that. Then do it, everything goes fine.
Okay. And so what about the costing between the skin boosters, the fillers, Botox? How much is the cost difference?
See, usually it differs from individual to individual. The patient I'm talking about, because everybody needs everybody's wants are different, as in desires, and everybody needs are different. Needs, injector will decide what is required for you. What you want, you have to tell me. Then I'll say that also we can do, but I think you need this also so that it completes your look.
Yeah.
So all these things that means you need a lot of counseling.
Okay.
A lot of counseling. So if that happens and if they agree, depending on the severity and what they want, how they want, you can do it one go. Maybe because of budget issues, so you can do in intervals also. So mostly we do in intervals only because the budget becomes an issue. So injectors, many injectors. In Mumbai, they have so many injectors. In India, you have so many injectors. So everybody charges differently. The Botox, usually in India, we charge per unit. Okay. And in fillers, we charge per syringe. The syringes come in 1 ml syringe, pre-filled. So it's like that. So somebody needs 2 ml, somebody needs 4, somebody needs 10 ml.
Okay. But like what is the approximate?
Approximate. It's
cost
few
for-
thousands to maybe 2-3 lakhs.
Okay.
Depends.
For
Maybe
Botox?
more also. The Botox, few thousands.
Few thousands. Yeah.
Should be enough.
You
Fillers.
mean few 30,000, 20,000, 10,000? What is it?
Well, I told you, it depends,
Depends
on
on
how much I'm charging per unit.
Yeah.
So
But in a metropolitan city, like the average cost
20 to 50,000, maybe
Okay.
60.
for one problem
Fillers,
area.
yeah.
So that is for Botox.
Botox, yeah.
And
Fillers depend on how many syringes we use.
Okay, so fillers must be more expensive than Botox?
Yeah.
Okay.
Because it depends on the volume loss. How much is the volume loss? See, nowadays people take those injections to lose the weight. And, the Ozempic, Mounjaro, people are looking like haggard. One patient came to me, sir, I did everything so nice and I've lost so much. But instead of getting compliments, I'm getting comments. I didn't do this for comments. I said, if you want compliments, then you have to spend some more because you need. Then you're like, sir, both kharcha hai. Well, I know. Aesthetic is all about kharcha. It's luxury.
Obviously.
That's why we pay 18% GST on in all these procedures. It comes under luxury.
Oh, okay. So you're saying fillers will be almost double of Botox?
Well, double, triple, depends on what they want. Yeah,
Got it.
there is nothing like fixed thing.
Yeah.
Per syringe wise, some need 2, some need 3, some need 10, some need 15 also. Yeah, the syringes depend on the requirement and what they want. So depending on that, we suggest those many. If they agree and if they can afford, we do it everything together. If not, then we may divide it. So usually we do the first periorbital area because the moment you see somebody, what comment or compliment we get? You're looking tired. What happened to you? It's just a fraction of a second everybody says that. What we see actually in a someone's face is eyes. If eyes look tired, sad, people say, what kya hua tumhe? You're not well, kya, whatever. So what we do is, first thing is we take care of the periorbital area, which includes the cheek lift, cheek support, and under eye, maybe a little eyebrows and the crow's feet and all these things with Botox and fillers together.
Together.
And then they come back, then we may go to the lower face because lower face takes a lot of volume. And in India, the chin is a big problem in India because most of the Indians, we lack chin. Even I lacked it. I have filler in my chin too.
Oh, is it? Okay.
Yeah.
Lack chin means what do you mean, sir?
Our bone is not well developed.
Okay.
The mandible.
Oh, you mean to say it's blunt?
It's blunt, it's small, it's retrognathic, okay, micrognanthia or retrognanthia, or some have both. They actually need surgery.
So okay.
We keep adding fillers, and because of safety, I can't put too much at one go. So usually we do it in 2 to 3 sittings. The chin augmentation. The moment you get the chin, so profile from far, everything looks better.
Okay, so you get a well chiseled face. You're meaning to say.
Exactly.
Okay.
Chin is a big thing in India.
Ah.
Because everybody lacks it and everybody wants jawline.
Okay.
ऐसे jawline के लिए पहले chin करना जरूरी है.
Okay.
Because unless you have a good projected chin, you can't get good jawline.
Sir, in Bollywood, we see a lot of celebs, not just Bollywood TV serials everywhere, getting these unnatural looking lips. The procedure sometimes maybe gets botched up. And after looking at them, we feel scared of going for these procedures, right? Because it can go sideways also. So, is there like a fine line between getting a perfect face, just a little tweak, versus getting that plastic face? Uh, how can one avoid that?
Well, there are two aspects to it. One, some people want that way.
Oh,
I want more pout. I want these kind of a cheeks. I want that way. So injectors sometimes succumb to all that. Sometimes, but most of the time we say no, may not suit you. So let's do this way, that way. So it's obvious. Obviously, you have as an injector, you need to be firm. I don't want to do that way.
okay.
May not see. They'll come with some. I want to look like some. I want to have cheeks like somebody. I want to have lips like somebody. I want to have a nose like somebody. Like somebody. It's not that way. What I'm gonna do is I'll make a better version of yourself.
Yes.
Don't look like somebody. We don't want to make it look like somebody. That used to be a trend before. Everybody wanted pout. Pout. Obviously, if you ask me, have I created pout? Yes, I have created pouts too, but not duck-looking ones. But yes, we have seen those little bit happening. But I don't blame the injectors because the patients force them. If I see, the problem is if I say no, they go to somewhere else.
Of course.
So what happens is in those clinics, they keep doing it. So what I keep suggesting everybody is be firm. Thankfully, these trends have gone. People don't want loud things on their face. Very subtle. They want everything to be done, but very subtle, very natural. I thank God. When the person comes and says, sir, do whatever is required, but do it in such a way everything looks natural. That's what I want.
Yes.
I don't want to make it look obvious. See, people should notice your changes, your all whatever change happen, but where the change happen, they should not know. That should be an ideal, and that should be a good injector.
Okay.
That is an ideal injector who makes the changes noticeable, as in the looks wise, but where exactly has changed, we don't know. They have to keep searching. Where does it change? So that's earlier when people used to do loud things. People, my patients only tell me, sir, मैं कहीं पार्टी में जाती हूँ तो हेलो हाय के बाद इमीडिएट तूने चीक करवाया तूने लिप कर ऐसे ही चालू हो जाता था because it used to be loud before, but now things have changed, the trends have changed, the understanding of the facial anatomy and the aging has changed. We have better products to do all this. So we do whatever is required. We do it subtle and unnatural looking looks.
Yeah. But that is in the hands of an expert, exactly. So, see, I know you. So, if I have to get a procedure, I can come to you. But what about those people who are maybe outside of this state or outside of this country? And what should they look in an expert? Are there some degrees or something that they must look into before choosing their doctor?
See, nowadays, you open the phone, you open the laptop, you open your iPad, the social media is flooded with many things. If you ask me who do I follow, I don't do follow too many injectors because they every day they'll keep adding something or the other, something or the other. And my patients keep watching those videos and ask me, do you do this? I said, I can, but it has some risks and all these things. But anyways, what I'm trying to say is, don't go with those social media things. But yes, the expert experience is very important,
Okay.
and word of mouth about that particular doctor. Social media is all about self. Okay, I do this, I do that, I do this, but who knows what you do? But yes, some are very genuine. I know a lot of friends who do it good job and they're on social media. But this is a social media era. You can't help it. It's a two-edged sword.
Yeah.
Some may do good job, may not do it. But as a patient, you need to select but it's in your hand. You have to do a lot of research.
Okay. So, it is associated with a degree, right?
Yeah. It's in India. It's a post medical degree with properly trained, certified, trained injectors can do it.
Okay. And is that degree called something? I mean,
No,
different in
see, in
different
India,
parts.
dermats, plastic surgeons, aesthetic physicians, they all do it after the trainings by respective companies and the experts. So once you get trained, you start injecting, you gain a lot of experience and expertise, so you can start doing it.
Okay.
Yes, after the medical profession,
Okay.
you finish your medical school.
All right. And I forgot to ask that question. The injectables, the skin boosters, what is their cost like?
They're a little lesser
Cheaper,
compared to
yeah.
the dermal fillers, but yes, again depends on it. Usually, it's not too much. It's 2 to 3 or maybe 4 syringes we do it for the face, so should not go more than few thousands.
Okay. All right. Few thousands meaning 10,000,
Close?
5,000.
No, it's again, it depends on
Depends.
individual
But it has to be done
doctors.
twice a year, right?
Twice a year.
All right.
But our trend is skin quality improvement.
Okay. But depending on the budget, one can always reduce the number of injections, right? Or it
No,
won't give that
if
effect.
yeah, exactly. The way I always in my trainings, I always tell the doctors, try to put the optimal dosage.
Okay.
See, many people think if I do 3 or 4 or 5 syringes, I look like a pillow face. Pillow face, everybody's scared of. I'm actually fed up with this word called as pillow face. Yes, some look like pillow face.
You mean swollen up?
Swollen up. It's unnatural, overfilled areas, especially the cheeks and lips and all these areas, especially those areas. But they are overfilled unnecessarily, even if it's not required. But if I see a patient who comes with a lot of volume loss, sagging, if she or he needs certain number of syringes, that is up to my assessment. When I do the assessment, it is required. Do you need 8 syringes, 7, maybe 10 syringes also you may need it. Because again, need it. Yeah, if they can afford, we can do all the syringes at one go in a proper way. Or if not, in most of the cases, when we see the budget becomes an issue. So what we do is
Stepwise.
with stepwise. And that's the best way to do it because they don't feel too much also budget wise and on the face wise.
Oh, okay.
But again, pillow face can be created by overfilling unnecessarily and wrong fillers in wrong areas. As I told you, the companies have different produced different fillers for different areas. So if I don't choose those properly and if I don't do it in the proper anatomical plane, then I can get it. See, if I have done 10 syringes today on a face, and if she comes next month or 2 months, add some more. I'm not joking. People come and ask you, I want some more. Well, it's up to you. It's an injector. You said, I'm done. Let's wait for some time. You need to give the fillers to metabolize from your body, or Botox to metabolize from your body.
So if somebody comes with a botched up procedure to you, you can help them out, right?
Yes, we see. Good thing about the fillers is that HA. So we have an antidote called as hyaluronidase. So we inject and we can remove it also.
Oh,
Yeah,
wow.
we can remove it also. So that's not an issue. But with the Botox, it's like adding salt to the food. Namak zyada ho gaya, I can't. So we have to wait for a couple of months or 2 or 3 months. It'll anyways come back. They're all temporary, these things. So fillers are more problematic if done wrongly. Okay, so from bruise to swelling to skin necrosis to the blindness also.
Blindness with fillers. How so?
That's why the anatomical knowledge, your experience, your mastery over the injections makes you the expert injector. So if you do it properly, so all these things will not happen. So there are a lot of steps we take. We stay in the right plane because that's what we give the trainings. We attend cadaver workshops. They give you a lot of knowledge about where the artery is situated, which artery goes where, how, which plane. So which plane I need to avoid as an injector. So if you do all that, and plus use the correct product. People think, I can use, because if you use a thick product near to the artery, it can compress also. It's not intravascular, extravascular compression also.
Okay.
But most of the people worry about intravascular, injections, which have caused many problems all across. But compared to the injections, billions of injections are done, maybe few hundreds have happened. But again, the number could be, the percentage could be 0.0001%. But again, as an individual practitioner, you don't want that 1%.
Yeah, these are rare complications, but
Very
they
rare.
can happen.
And see, they're the cosmetic procedures. You can't afford to have such dreadful complications. That's
So
why the
apart from blindness, what are the other complications
skin necrosis, if you
with Botox and
fillers.
Only with filler.
Mostly because they're thick material, the viscous material. See, they block any artery or vessel, so can cause the blood supply, the problem in the
What else?
the bruise, which is common, which can happen, which goes within few days. The swelling can happen because of the injections, which will go in 2 or 3 days. The bruise may take around a week to go, so that should be good enough.
And Botox, any side effects?
Botox, yes, if it is done in the wrong muscle, it's all muscles.
Ah,
You have to know which muscle is causing this. So if you do it properly, everything is fine.
fine.
If the muscle, by accident, I don't say the injector wanted to inject in that way, if it just goes accidentally into this adjacent muscle, which is doing something else, and you stop it doing it. So what happen once? Brow ptosis can happen, lip ptosis can happen.
Meaning it'll get paralyzed, kind of, right?
That muscle gets relaxed or paralyzed. So that effect.
It'll look sloppy.
Yeah, sometimes the smile can get
Spoiled, yeah.
spoiled with that. But again, these will improve within few weeks to maybe a couple of months.
Okay. But the hyaluronidase injection that you said is like the antidote. That's for the fillers, right?
Yeah.
So it's
Hyaluronic acid fillers.
yeah. So it's easy to fix a botched up filler than it is to fix a botched up Botox. Okay.
Because Botox, you can't undo
just
it.
undo anything.
Undo it. Just if the muscle is relaxed, so it has to
Yeah.
get its strength back, which happens within few weeks to a month or two. But
What ab-
fillers,
Sorry.
fillers, yes, you can hyalase, but as an injector, you don't want to hyalase each and everybody.
Obviously.
Because when you hyalase, you don't know how much you're hylasing. You may hyalase too much of fillers what you injected. Then you have to redo it.
Repeat it. Okay.
But that is there, but it's like it is there. But don't think I have it. Let's do everything.
Sir, all these procedures, like which ones are the most high maintenance ones? I mean, are there any specific things that you have to avoid after getting these procedures done?
Well, yeah, because after all, these are all injectables, so there can be a bruise or hematoma. So we usually avoid the blood thinners.
So you mean to say that the bruise can cause a big swelling because of the blood accumulating?
It's hematoma. If there is no hematoma, just a bruise, so it can cause a little bluish, blackish mark on the face, which goes eventually within few days. But to avoid all this, people can avoid green tea, which is supposed to give it makes your blood thin.
Green tea?
Yeah. So avoid green tea before and after. If it is done electively, so try to avoid it before 2 or 3 days and after that. But if it is done, patient walks in and wants right now and she says, I'm on green tea. Okay, पी लिया है, but अभी 2-4 दिन मत पीना.
Okay,
And
interesting.
that vitamin E, whichever causes the blood thinning, try to avoid so that the bruising and all things will not happen.
That's it. Only green tea, vitamin E is to be avoided.
Yeah.
Otherwise, you're back to normal life.
Yeah. And if somebody has some allergies or whatever, you have to some little medical history. If they have uncontrolled diabetes, uncontrolled hypertension, so try to get it corrected before, because you don't want any infection to be caused.
So if they get a facial or a facial massage, it's not going to hamper the procedure.
Yeah, fillers of post care is very important, because when we inject, it's a gel which is injected, but since it's HA, it integrates with your own HA, but not immediately, but it takes time. So till then, one needs to take care so that there is no pressure on the face, so they can avoid the swimming, gymming, facials, massages, and steam and sauna for few days. Maybe 3-4 days
Okay, that's it.
of that, but heavy exercise and swimming all should be avoided for a few more days. Facial massages, usually we save 10-15 days.
Okay, but after that,
Because
they can do whatever they
after that, once it is integrated in your skin, you are as normal as possible. Doesn't mean that you have to sit at home. As I told you, these are all lunchtime procedures. Get it done. If you don't get swelling and bruise, go back to work.
Great. All right. So it doesn't seem to be too much of a problem.
Not at all. That's why these non-surgical procedures are much
Easy.
more preferred over surgical, because they have some downtime.
If someone doesn't want to do any of these procedures, like they're scared or don't have the budget or whatever, then what are the other available options which are not just cheaper but maybe easier to do?
Well, it's not someone, but it's many actually. Still, many don't want to get the injectables done because of the fear, because of many things, and of course the budget also. But if they want to, just give a little subtle changes, little bit here, so you can go for energy-based devices like a little tightening and lifting with HIFU. Now you have endo lift.
What is energy-based device?
And the lasers.
Lasers, okay.
They work on different levels of the skin, and depending on what you want, we set the device accordingly, and then it tightens the skin accordingly. But again, combination always works better.
Combination with what? What
With
other things?
injectables and energy based, it's
Together.
always there. But if they don't want to go for injectables, but they can go for energy based devices.
So amongst the lasers, like which one would be the best one?
Well, isn't
Because there are so many lasers.
there are so many, of course. It's obviously the injectors. The lasers are very expensive machines to purchase also. So injectors also, you have to think about it. Should I purchase this or not? Because after all, you're spending so much. But yes, there are a lot of technologies. The HIFU is the best one of the best ones. Now the trending one is the endolift or the microlift, which is kind of a minimally invasive. It melts the fat wherever you want.
Oh,
with that, yeah. I'm yet to start. I've not started it yet.
we do the face too?
Yeah.
Oh, wow.
But HIFU is commonly done because it's quite easy and very painless kind of thing. No downtime at all.
But it'll definitely require more number of sessions, right, sir?
Couple of maybe in a year.
And then how long will the effect of a laser last compared to
Say
Botox?
year and a half, 2 years.
Oh,
Yeah.
that's decent. But it won't be as effective as the filler or the Botox will be. This will be like more subtle.
Everything has its own
Pros and cons.
pros and cons.
Okay.
If I need volume restoration, I need fillers. If too much muscle activity, you need Botox. If this loose skin is there, you want to tighten it, you need energy-based devices. So that's why I said it's a combination always works better. And of course, overall, you want the skin to be better than the skin boosters.
Okay. Say I've done a Botox or a filler just before an event, and now I don't want to go and continue this ahead. Will that affect my skin in a drastic way?
Not really. Actually, many patients come to us for like before the event or function, anniversary, birthday, reunions.
Okay.
I found the reunions after the COVID, we had a lot of reunions, and some of my patients, they attended their reunions and they came back proudly and told me, "Sir, I was looking the best in my reunion." What do they suggest? Because they're taking care of the skin and their looks so well, when they met their friends, they looked the best. And the confidence they had was amazing. But doesn't mean that it's not mandatory. It's not a disease. The aging is not a disease. It's just a process. So if you want to look better, it adds a lot of confidence to your
Absolutely.
oneness. So if you want to do that, you can. But if you don't want to do it, it's okay. It's up to you.
Yeah, it's a
You'll
luxury.
back to what you are. But is it addictive? No, it's not. The looks are addictive, but the product is not.
Okay, all right. So it's more like a luxury. If you can leave it at whatever point you want, right? It's not gonna really make a huge difference in the way you are.
As I told you, many patients do it just before the event. they're okay. And then they may come to you only again when there is an event. It's
Yeah,
okay.
it's fine.
But when they come to you again when there is an event, obviously you age every day. You may not be the same as today after a year.
You might need higher doses, maybe.
Whatever, it
Yeah.
depends. So it's like that. So assessment is very important.
Okay, great. Sir, I got to learn so much about Botox and fillers. I had no clue about any of these procedures being a doctor, and I'm sure the audience out there is also having a wonderful time listening to you and getting to know so much more about this aesthetic world. I'm very grateful for you to share this knowledge out in open and give us this confidence about going for this procedure whenever one wants to and not be scared of them. So thank you so much, sir, for
Thank you so
being.
much, Dr. Aditi. And it was lovely talking to you about the Botox and the fillers, injectables. And they're very simple procedures not to be scared of. They are highly studied drugs, medicines since many years, and all FDA approved products. So, no, safety wise, they're best. You just choose your injector wisely. That's all I can tell you.
Yeah, absolutely. I think that is one take home message for all the people listening to this podcast, that it's not something to be scared of if you go to the right person who uses the right product. So, yeah, if you like this video, please do share it with someone who might need it, and do like, share, and subscribe. Thank you.